Hi, thank you so much for the just relaxed interchange of this, webinar, and I hope you will continue them. It's great. And also, I love your Pyrex measuring cup coffee. So my question is, I am a hospice massage therapist. In a rural county, so I go to people's homes and work with them. And as you obviously know, many people, some people go on hospice and they only live for a very short period of time. Some people go on hospice and they live for years. And I am looking for just kind of random stream of consciousness, if you will, about ways that I can support celebrating what their bodies have given them while holding and comforting fear and confusion, because some people are older and have some degree of dementia. Without overstepping my scope of practice. There's a simple question for you. So anything you've got to say would be valuable.
Oh, Ileana, thank you. And I bet you have, I may be curious to hear how you have been dealing with that. But as you're talking, where my mind is going is that the job of anyone in a therapeutic exchange in this realm of illness, serious illness, etc., massage therapist, physician, social work, nurse, chaplain, music thanatologist, many different ways that we are in some therapeutic exchange. So for my money, so much of that work really has to do with, like, your job. My job is finding a way to hold all of it, and not resist any of it on some level. Just if it exists, okay, you're welcome. Here it is. Fear, fine. Here it is. Delirium, dementia, okay, you're here. So much of the job of for the therapist is finding a way to hold all of it and not try to surgically remove parts of it. I mean, if you can surgically remove pain, okay, but not trying to. Sometimes I watch myself in a 15-minute encounters and stuff like that. You start clipping too many things off the sides to stay in your little lane. That ends up being such a disservice. So finding a way to hold all of it, shame none of it. That doesn't mean you have to we don't have to be happy that delirium or dementia is in the mix, but your job of acknowledging it will help them acknowledge it, will help them accept them, especially in your world of touch. Ileana, it was so powerful, especially when our bodies are falling apart, to find something to look forward to in the body, a feeling that feels good, a reason to like having a body. Your job is liaising people back to their bodies. So powerful. And that may be touching while talking, so that they feel, sometimes it feels like, as a sick person, I have felt repulsive, and so touch can overcome so much of that fear and repugnance, and almost implies acceptance just by the fact that you're touching them. So I don't know if these stream of consciousness are helpful at all, Ileana, but I wonder, I bet you're already doing all these things. I guess I would just note, if you're ever finding yourself ignoring a part of someone's experience or blocking it out, that's on you. That would be your work. This is why I guess we all call this a practice, and we get better at it as we practice our craft. But does that make some sense? Are we in the same ballpark?
It does. And if there's time, I mean, could you, obviously sometimes we don't know what we're ignoring.
Yeah.
Until 2 hours later we go, ooh, I'm carrying this around. So just, I guess I don't know what my question is. And actually the value of it is that now I have a question to ask myself.
Well, there you go. I mean, I guess one more little reflection and we can move on. But there are so much of, I think, of the plane we're talking about can be very subtle signaling. And I wonder how, that's why I imagine your work over time, you get much better at like, the exquisite, subtle, fleeting nature of some of these thoughts and feelings. And it would be interesting to hear how you pick up on those over time. And like you said, maybe 3 hours after an encounter with a client that you feel something in your gut about something they said or did or look on their face, and I would just encourage you to make sure to honor those reflections, because I bet in there's a lot of really good expansion for you as a practitioner. And then next time you see that person, you can say, hey, I felt X, Y, or Z after we spoke. Does this light up for you? Does this make sense to you? I was feeling X. Does that register with you? And this sort of song and response with your clients, I could imagine being very, very helpful. But a lot of these signals are very, very subtle. Yeah. And if you can get really exquisitely good at seeing those subtle cues in yourself and in your clients, wow, I would, let's give you the Nobel Prize. I mean, that's such powerful, important, really, really important work.
No, thanks. Just give me insight, please. But I will also say that has happened, and I don't know if that's within the scope of this webinar, but with caregivers as well and spouses, because their journey is also very difficult.
Amen. Yes, ma'am. Totally, absolutely agree. And often unrecognized because they're not the pain. So in some ways we have to go a little farther to make sure to note what's going on around the patient. Yeah. So, okay, beautiful. Thank you so much. I hope that we can talk more.